Just before we start, I just wonder if you could just tell me your name, please, spell your name, just give me your title here with the organisation.
Okay, my name is Dean Fennell. I'm a Professor of Thoracic Medical Oncology based at the University Hospitals of Leicester.
And how do you spell your first name and surname, please?
First name is D-E-A-N, second name F-E-N-N-E-L-L.
Thank you. Okay, Dean. So you've got an idea here for a Mesothelioma Institute. What will that mean for patients?
Well, the Institute is basically for patients. It's essentially a way of bringing together many of the research programmes that we have, activities that we have within Leicester, including clinical trials and laboratory research, in order to try and advance therapy for patients.
So where would the patients come from? Where would you get funding from? Is it a sort of wider pool of funding or what?
Yes, we have a number of grants, some from Cancer Research UK, we also have funding from the BLF. This is directed towards understanding how we can better treat the disease. We have clinical trials which are funded by external agencies such as Cancer Research UK.
And a Mesothelioma Institute, would that be the first of its kind here in the East Midlands or what?
This is part of a wider national effort. We are basing our work on the clinical side of things, but we also have collaborations within London and also within Cambridge.
Now tell me about the type of patients that you're getting through at the moment, the rate and the age ranges.
So the patients that present with mesothelioma have typically been those individuals who have worked extensively with asbestos, plumbers, electricians, that sort of thing, where the exposure risk is obviously very high. We are seeing a number of individuals, particularly younger patients, and those individuals who have now come from an environment where they didn't directly work with asbestos, such as teachers, nurses, for example, where we're having to now think about how to best treat them.
And what sort of age range of these patients and what can you do for them?
The typical patient will be male and over 70. However, we are seeing female patients as low as in the 40s, and the main treatment options that we have available are really based around the standard of care, which is the use of drug-based therapy, chemotherapy. However, new advances are allowing us now to explore treatments such as immunotherapy, particularly in the second-line settings and after the failure of standard treatments.
And when you see younger patients coming through, like you've been talking about, people in the 40s, I mean, how does that make you feel?
Well, clearly these individuals have been exposed through environmental exposure to asbestos. I feel pretty much the same as I would, I think, across the entire age spectrum, but it is a concern that these younger individuals were exposed perhaps as children. The disease takes around 40 years to manifest, and therefore those individuals would have been exposed in early life.
What does that indicate to you about the need to perhaps remove asbestos from public buildings or treat it properly?
Well, certainly one of the focus for our institute will be prevention and trying to understand how we can identify patients earlier, intervene earlier and prevent patients from developing this terrible disease. One of the easiest ways perhaps to attempt to try and remove the risk is to remove the environmental exposure to asbestos, but I appreciate there are huge challenges given the ubiquitous nature of the substance asbestos.
And you're doing some more trials now here, I think, at the moment. So just tell me about those, please.
So the clinical trials we're focusing on cover a range of types of mesothelioma. So both the mesothelioma above the diaphragm, which is the chest, the pleural mesothelioma, and then below the diaphragm, the peritoneal mesothelioma. We're thinking about approaches now that involve harnessing the immune system to target the cancer, and also genetically targeted therapies. And both of these new approaches hold a lot of promise to hopefully dealing with the disease more effectively.
How long will these trials take?
So the clinical trials are opening now, opening this year, and many of these trials will take in the region of a year to 2 years to enrol. Many of these studies will therefore be able to offer these new drugs to patients pretty much immediately. It's only, however, on the basis of these trial results that the drugs may be more widely available.
And mesothelioma, it states, on the websites and whatever, it's an incurable disease. I mean, what sort of hope are you giving to patients coming through now to you?
Yes. Well, I feel that at the current sort of state of affairs, we have only really one licensed therapy on the NHS, which is chemotherapy, 2 drugs essentially. What we hope to do is to offer a broader range of therapies for patients which, if effective, may have the potential to improve survival for individuals and really give a little bit more hope that these individuals will enjoy better quality of life for longer. Just getting that MIST trial up and running, and then hopefully get some surgical protocols as well actually developed, which would be, I think it'd be really fantastic actually. Hang on, if we've got, oh gosh, hang on. So 200. Okay.
Put in now, so away you go. Go on, carry on. Yeah, carry on.
Okay. I think it's trying to optimise speed and obviously robustness in the nature of the paper, what we present. I think.
Well, some of the ones I'm repeating.
Yeah. Okay, that's perfect.
Essentially, a complete set of data.
Fantastic.
So,
Fantastic.
And then that will be for the paper.
Okay, that's really fantastic.
Through as well.
Great.
UK.
Great.
So,
Great.
That's been forwarded to the university. They've acknowledged it and accepted it.
Okay, I've been speaking with Novagene
Uh-huh.
because we need to find a provider for the sequencing. Okay.
To the doorway, please. Thank
Okay.
you. And okay. And okay.